Hi everyone, we'll be discussing today regarding Paget disease of bone. Welcome to the video. Let's discuss about Paget disease with a case presentation or MCQ, then we'll go towards the important contents. So Paget disease, this case was 82-year-old man, had progressively worsening lower back pain. There is a bilateral hip and right shoulder pain as well, and this was for past 6 years. He reports that he has had to buy larger hats. On physical examination, there is no joint swelling, edema, warmth, or tenderness, but the range of motion is largely reduced. Radiograph shows narrowing of joint spaces with adjacent bony sclerosis. So adjacent bony sclerosis is being found. Skull radiograph shows thickening but diminished density of skull bones. Bone biopsy at the iliac crest shows loss of normal trabeculae with a mosaic pattern and increased number of osteoclast and osteoblast. Which of the following complication is the patient likely to experience as a result of this condition? So remember the important feature, 82-year-old, there is a progressively increasing pain over different bones, there is increasing head size, and bone biopsy shows loss of normal trabeculae. The mosaic pattern is extremely important. There is increased number of osteoclast and osteoblast, that is again a high yield feature. So all these features are in the favor of Paget's disease of bone, and Paget's disease of the bone predisposes clearly to osteosarcoma. So we will discuss now the salient features of Paget's disease. So it will be very clear that this particular case was a case of Paget's disease. So Paget's disease, also known as osteitis deformans, this has some general features. There is a matrix madness, and there are various genetic mutations that takes place. There is overgrowth of both the osteoclast as well as osteoblast, and there are three phases. There is increased osteoclast resorption. So there is increased lytic activity initially. So osteoclast do not follow the osteoblastic activity, and they just go rampant proliferation. Then comes the increased hectic bone formation or osteoblastic proliferation now also pumps in. So both osteoclastic and osteoblastic activity are stimulated. So this is the mixed phase. And finally, there is osteosclerosis. So in this phase, there is sclerosis, marked sclerosis, and osteoclasts are exhausted at this stage. So osteosclerosis, we get only the sclerosis. So now let's see what are the different pathogenic features. So pathogenic features is not very clear. It's a combination of environmental and genetic factors, and the mutation in SQSTM1 gene. So remember this gene. So this gene is clearly being mutated in familial Paget's disease as well as sporadic Paget's disease of bone as well. The SQSTM mutation is known to enhance the NFK beta activation, leading to increased osteoclastic activity. Mutation in the rankle and rank OPG also have been found in some conditions of Paget's disease. There is a very high risk of acquiring osteosarcoma. Also, some cases they develop even fibrosarcoma, but high risk, very high risk of osteosarcoma mostly. The clinical presentation. There is average age at the diagnosis is 70 years, so around 7 to 8 the decade. As in the present case also, it presented at 8 the decade, so that is the common age of occurrence. Main feature is the bone pain and the skeletal deformity. There is increasing head size as was there in our case. So there is increased bone size, that is a feature. Line the faces, facial abnormality can occur, facial deformity can occur. Bowing of leg as seen in this pic, that is there is a bowing of the leg, that is very characteristic feature. There may be some fractures, elevated alkaline phosphatase, and elevated urine hydroxyproline. So it's a breakdown product of connective tissue. So these two markers are elevated, and these are very clear-cut diagnostic features along with the clinical features. If we get these two biochemical elevations, then it is clear-cut indicative of Paget's disease of bone. Mosaic pattern. So you can see the mosaic zigzag pattern. The trabeculae are very zigzag and connected to each other. This is called as a mosaic pattern. Mosaic pattern is characteristic of sclerotic phase. Now it's important that they are only seen in sclerotic phase. Other phases may show increased osteoclast, you may see osteoclast and all. So there are not any specific features in other phases, that is either osteoclastic or mixed phase. We do not get any specific activity, specific radiological feature or biopsy feature, but here the mosaic pattern is very characteristic of the final phase, that is the sclerotic phase of Paget's disease. Coming to the treatment and complications of Paget's disease. So the treatment and treatment includes the calcitonin, which inhibits the osteoclast. The bisphosphonates can be given, which causes apoptosis of osteoclast. It causes the osteoclast to be exhausted, so thereby it keeps the osteoclast in check. There is the complications of Paget's disease. The clear-cut complication is the development of sarcoma, osteosarcoma, mostly very high risk, and some cases even turn into fibrosarcoma. There is high output cardiac failure seen in many of the cases. This is due to the formation of abnormal arteriovenous shunts in the bone, and that causes increased blood flow in this abnormal channel, and that causes increase cardiac load and can cause high output cardiac failure. So high output cardiac failure, osteosarcoma, these are the clear-cut complications of Paget's disease. So let's have a quick recap of what we learned in this presentation. What we learned, that Paget's disease is a disease of 7 to 8 decade. Paget's disease has osteoclastic, then osteoclastic and osteoblastic mixed phase, then osteosclerotic phase. So there are different phases of Paget's disease. Paget's disease is due to SQSTM1 mutation, and Paget's disease also may have Rankel mutation as well. Paget's disease, the important complication is sarcoma, that is osteosarcoma or fibrosarcoma. Calcitonin and biphosphonates are used in the treatment of Paget's disease. So these were the high yield points of Paget's disease that you ought to know. Hope you like the video. If you like the video, then give your valuable feedback, and also subscribe to the channel and stay hooked to the channel for upcoming videos. Thank you all. And also don't forget to see other videos of this channel that is there. So all the other high yield videos, please have a look over that and give your feedback. Thank you.